Okay, so our conversation just made me think about the fact that forget like our bias to public health, other aspects of healthcare, like the lab scientists, different people, they are just okay, the lab scientist I'm not going to that one like my cousin, my sister-in-law, she's a lab scientist, and I'm always thinking I have a friend I have friends that are lab scientists. I'm always like they need to do gloves that injection cannot pierce through. Because you don't know where you're choking that needles. And you don't know what can happen. When I was working in the primary health care center, I was working, the needle basically choked one of the nurses. And you should see how all of us feel all the needle choke with panic people are. Because we're just like, what if that person was HIV positive? That's why she'll carry HIV.
Now, you can do PrEP. Where I work, there are 2 types of HIV.
Yeah.
So the doctor did an operation. And before he did the operation, it was not like an operation, it was like a delivery. So when the baby comes out, the water and blood, so it splashed and entered in the eye. So immediately he came to the HIV section. I was like, I need PrEP. So it prevents, he had already been exposed. Yeah. Now being pregnant. Do you understand? So they can actually do PrEP. But the place seems bad. Doing this was health practice. So
I said the non-profit healthcare center said, God, I beg, please, the healthcare center in Nigeria needs work. Because the toilets in that, I never use that toilet as that's a healthy place and the toilet is filled. I never use that toilet. I think the night that I was really pressed and I went to that toilet, these people we went back. I was like, excuse me, what's going on? It's very scary. It's scary. Like, how would I be sick? I'll come and I'll not fall sick again.
or not take an
infection from jail.
Where I work, I can't really relate because where I work, everywhere was I'm not joking.
Yeah, that's
everywhere was sparkling. Like, they had high-end public health departments, and it was not a private hospital. That was run by
hospitals that usually have public health departments. They have better facilities.
Public health,
because you cannot be a public health professional and be saying nonsense.
They had occupational environmentalists. They had everything.
Can you see how serious it is? You cannot be serious because the public health professional will not say that I will be fine. Your body will be like,
they had a crutch for nurses that have children, doctors that have babies. So when it's your period, you know how some women that are doctors, like I had this doctor that was close with, she was a female, I should just give birth to twins. So her maternity leave had finished. So she can't live with the 2 of them. So she has to
also think maternity leave is something that is.
Do you understand? She had to come to the crèche with the baby. And then so the women at the crèche came to come and complain that there were rat holes and rats were running.
Rats,
yes, were running in the crèche. So, immediately that the complaint was made, the public health, the head of department, he's a public health consultant, he picked me and the environmentalist. Oh yeah, let's go. We went there. I'm telling you, this woman came, made a complaint. She didn't even have to write it down. Or he was like, all those procedures can come later. Yeah. And we dined there. When we went there, we saw that there was a place where they passed, this, AC.
Okay.
Yes, there was a place where they passed it and they didn't see it. That was one. 2, these doors that are high. So the under is okay. Yes. So that was something I noticed. And then when we're, those kind of checks, and then your eyes now miss other bad things. I was like, why is this toy here? There was a toy with sharp edge. So we're able to remove a lot of things just from that inspection in
what's wrong that one.
Probably if we had, do you understand? Probably if we had waited and say, okay, what do? And then after that day, I now thought back to the people who come to the hospital with emergencies and they say, go and bring your card. Go and do the procedure.
I was sick one time. I'm not trying to say that doctors are not working hard, nurses are not working. Now we get that you guys have a lot of people coming in. But please, I cannot be bent over. You're telling me go and bring your file.
The priority is
how do you want me to go and bring it? I should ground there.
Policy act that we read, it was to get treated first.
Yeah, the film. Not in Nigeria. You pay for it.
That's why I feel like some of this policy, apart from epidemiology, I feel like another aspect I'm very interested in, I don't know what I was saying, is health policy and health systems. So, apart from epidemiology is like something that comes to me easily because I'm good with data, I'm good with calculations. But health policy and health systems, they need to be really intact. Because I feel like so that health systems class that we had, I feel like there are a lot of good policies, just that we don't know.
When we keep complaining about the same, yes, we keep complaining about it, and it's one thing. There's no money.
It's not evaluation.
That means this year they will still maintain the government. No, things they have to life in place. People are dying. You see, people are dying. Like COVID is COVID is not something that we should have waited for it to come before we are looking for vaccine. I'm sorry, but that's the truth. We should have anything Ebola, Lassa van, all of them. We are not supposed to be waiting for those type of things to come because, to be honest, in Africa, it most likely would 100% start from Africa. Because we have tough skin and everything. We get that's what people are trying to say, but please don't kill us first. People now realize that you need to go and do it.
Exactly.
Do it. If you do it, okay, and it does not come, you did it. At least if you come, and we have some.
Yeah.
Do it. So please, like, public health is very versatile, and if we sit down here, we can talk for hours and hours. Like, we can tell how much we range of public health from all these conversations that we've had. So, like, we just want to make the world better, not just Nigeria, not just our areas, but the world. And if you're a young public health professional and you're still trying to find your space, find it or see, copy somebody. See, if you have not found it, do everything. You can everything. Do epidemiology, do health science, do health everything.
Because I feel like my hand is everywhere. Let me tell it. I'm not always lie. My hand is everywhere. I can plan programs. Program planning service funny to me because it comes at the top of my head. Program planning and
like once you've told me about someone health, I'm always like, oh my God.
Yes, program planning is at the top of my head. I know how to. When she was talking about writing grants, I was exposed to writing grants, so I feel like my hand is everywhere. So I was like, when your hand is everywhere, what do you do? And then she was like, you start from somewhere first. You get. I also like to plan programs. I like to be like how Fedro said that, when you plan something and seeds come out in it gives me so much joy. I used to so much joy because you know that let me do this thing.
Yeah.
And my heart does that. Let me go. Yeah.
Like call us selfish and say, oh wow, you get to do this for ourselves. It gives you joy to see something becoming better. It gives you joy, like if somebody becomes a president in Nigeria city and you begin to see change, you'll be happy, won't you? Even the person itself will be happy because people will be happy at the president. So it gives you joy to see that this thing is working out for somebody. This thing is going well for somebody. So please trick your hand everywhere. Do your hand in everything. And if you are thinking of, as you find the one that you really like, and if you are thinking of choosing a course and you're not sure if you want to do medicine, you're not sure if you want to do nursing, do public health. You will enjoy it. You will enjoy it and come with that mindset that you actually want to do well. See, do public health. Anywhere you want to go do well. Use your brain. So yes, thank you guys for listening to this episode. I know it's a little bit long, but if you stay to the end, we love you. We love you so much. And we really appreciate that you actually listening to this episode. Anyways, I love you. God loves you more. Bye guys.